Hi, this is Sharon Coronado, and this is my assessment of the integumentary system, hair, nails, and skin. And we're also going to do an assessment on the head, the neck, and the lymphatic system. We're going to start first with the skin. This is my patient Dan, and his skin is tan, nice and even coloring. His skin is warm and dry. He does have a little skin tag up here over his eye. And we're going to do a little mole check over here. He's got a mole on his left leg. And when we measure the mole, it's less than 1 centimeter by 1 centimeter. It's a little bit raised, it's rounded, it's brown, there's no other coloring in it. And the patient says it's not evolving at all, so it hasn't changed at all. So then we're going on to the nails. And we're going to look at his nails first, and his nails are nice and smooth. They're they're rounded. The skin is intact, and when I press on his nails, he's got good capillary refill, and his luna is fine. And we look across, his other nails are good. He does have one irregular nail over here on his toenail that's a little bit large and has a little bit of skin breaks around it. I'm going to have you put your fingers together, and we're going to just look at your two thumbs together as you put them together. Perfect. You can see a little diamond. That means no clubbing. Okay, you can relax your hands. Okay, so we're going to look at the hair next. And his hair is nice and clean and thick. It's black. He does have a little bit of dryness in his scalp. His other hairs on his arms are all even and symmetrical, fine black hair. And he does have black hair on his toes as well, on the big toe, so that's good for circulation. Okay, we're going to look next at your head. You're going to see that your head is nice and symmetrical, good contour. He's got no masses, lesions, or sensitivity in his head. And smile. When he smiles, he's got a nice symmetrical smile. I can see in his nasal labial folds that it's nice and even. He's got no tics or irregular movements in his face. And then I'm going to check his temporal artery really quick. I'm going to palpate it. I can feel it. And I'm going to listen very briefly with a stethoscope. See if I hear any bruits. I hear no bruits. Then we're going to move on to the neck, and we're going to examine the trachea first. I'm going to have you just put your head up a little bit. And swallow for me. When he swallows, it's nice and straight and even, midline. I feel no deviations. Okay, I'm going to check next his thyroid. I'm going to come behind here and just feel it. I'm going to have him take a sip of water. So when I feel his trachea, I can see if he has any nodules, grows some masses, and that moves upwardly when he swallows. I'm going to check the carotid over here. I'm going to palpate it first. And then I'm going to use my stethoscope. And I'm going to have him hold his breath when I listen. Okay, just hold your breath. So that way I can make sure I don't hear any bruits. That sounds good. Okay, next we're going to move on to the lymphatic system. And we're going to just check his lymph nodes to make sure that he has no swelling or any lumps. So I'm going to start first with the pre-auricular ones, the post-auricular ones, and I feel no masses. I'm going to do the tonsillar, submandibular, and submental. Then I'm going to just check the ones that go down the clavicular chains that go down his neck to make sure I don't feel any lumps. Now for this one, I'm going to have you just turn your head toward me and drop your chin a little bit, and I'm going to feel for the super and infraclavicular deeper chains just to make sure I don't feel any nodes there that are swollen. Okay, great. Okay, next I'm going to move down to holding your arm here. I'm just going to check here for your trapezial lymph node, see if that's swelling. I'm just going to hold your arm. I'm going to check in your axilla. I'm going to feel the axillary, mammillary, and pectoral lymph nodes, which I don't feel any. Great. And then lastly, I would check down in his groin and check to see if you have any swollen glands down here in his chain here in the groin. And that's it. That ends my examination. Thank you.